Okay, how you doing everyone? Welcome to anatomy tutorial number 3. Today we are going to talk about the types of joints that are found in the body. It is going to build on the knowledge that we have learned from anatomy tutorial number 1 and number 2, so please make sure that you have revised that content before you start this new content. Okay, so what is a joint? Well, a joint in the body is when there's a connection between two or more bones. So where two or bones meet and where movement occurs, well, mainly where movement occurs, we have got a joint in the body. We can classify the joints in the body by structure, mobility, or by range of motion. So we'll see that at some joints in the body there's little movement actually available. In this module, we're going to focus on classification of the joints by structure, and we are not going to focus on mobility or range of motion. So moving on from there, we can see that according to structural classification, we have got three different types of joints in the body. We've got a fibrous joint, we have a cartilaginous joint, and we have a synovial joint. Of those three, we're going to spend the most time and dig the deepest into the synovial joint, but I want you guys to be aware of the first two types, the fibrous joint and the cartilaginous joint. So looking at the fibrous joints, we've kind of hinted at these in one of our earlier tutorials where we looked at the skull. So we said that, oftentimes we think of the skull as one single bone, but in fact it's made up of 22 different bones that are fused together. So in the skull, where those bones are fused together, we have a special type of joint called a fibrous joint, also known as a fused joint. So this occurs where two or more bones are joined together by a very, very tough fibrous connective tissue. The bones are essentially sutured together, they are fused together, and there is absolutely minimal movement available at a fibrous joint. They are so tightly bound together that there is essentially no movement available at a fibrous joint. So examples of these include the various bones of the skull, or the bones of the pelvis, the ilium, the ischium, and the pubis. So they are three individual bones that are fused together to form our pelvis, to form our hip bones. So let's just take a quick look. I'm going to switch over to our different screen here and look at our skeleton. So looking at the skeleton there, we've zoomed in on this guy before. If we look at the skull, what we can see there are all these suture lines around the body. So if I select the frontal bone there, I can see a little bit more clearly this suture where the frontal bone has fused to the parietal bone. Sorry, slipped my mind there for a second. It's fused to the parietal bone. Also where it is fused to this bone here, which is called the sphenoid bone. We can see if we select the parietal bone, it is fused to the frontal bone along this suture here. It's fused to the temporal bone along the suture here. If we look at the back, we can see a little bit more complex interaction. So if we select the occipital bone, we can see this suture line running between the temporal bone and also between the two parietal bones that form this back part of the superior and posterior parts of the skull there. So these are all fused joints. So those bones are fused together. There's no movement available at this fused joint along here. At one stage earlier in our development, those bones are not quite fused together. When babies are born, they've got a little gap, a little hole in their heads around about here called a fontanella, which just allows for movement of these bones as the skull grows and before they finally suture into their final place. We also mentioned there we've got the bones of the pelvis. So if we look at the pelvis, we are talking about our ilium, our pubis, and our ischium there. So those three bones there, again, are fused together. There's sutures in those bones that join them together, but they are three individual bones fused together to form our hip or our pelvic bones or pelvis bones there. Okay, so they are examples of fused joints. Little to no movement at a fused joint, held together very, very tightly by a really tough fibrous connective tissue. Okay, moving on, we said we've also got a cartilaginous joint. Cartilaginous joints occur where two bones are tightly connected by either a specific type of cartilage or fibrocartilage. There is little to no movement available at a cartilaginous joint, but it's not zero movement like at a fibrous joint. So there's a little movement available, but not very much movement at all. So examples here are where those two, the bones of your pelvis, okay, so we said you've got your ilium, your ischium, and your pubis on either side fused together to form the pelvis, left and right. Where those join, where they join the sacrum, where we've got the ilium joining the sacrum, we've got the sacroiliac joint here, or where the two pubis bones meet at the front, we've got the symphysis pubis here. Okay, they are two types of cartilaginous joints. There's very, very little movement available at this moment at these joints, but there is a little movement. Particularly here at the symphysis pubis, there's a little bit of rotational movement available here. If you were to stand on one leg, for example, there's a little shift that can occur at this joint here. And in your sacroiliac joint, there's a little less movement allowed there. During pregnancy, these cartilaginous joints can be affected. There are certain hormones that are released during pregnancy that can affect how mobile joints are, and those hormones are released in order to allow space for the developing fetus to grow. So one result is that the symphysis pubis can relax a little bit to allow the pelvic bones to move slightly apart to accommodate the growing baby, but that can lead to problems sometimes, because if there's too much movement, we can get females can get pelvic girdle pain, which is when there's excessive or misalignment of the bones here during pregnancy or post-pregnancy, because these joints that are usually very tightly connected are allowing a little bit of excess movement there. So they're examples of cartilaginous joints in the body there. If we jump back to our skeleton, we can see again clearly here we're talking about the joint, this joint here between the sacrum, the bone at the base of the spine, and your ilium here. Or at the front we have where the two, if I just I'll exit that selection, where this pubis bone on the left meets the pubis bone on the right. And if we add in the connective tissue there, there we go, we see the interpubal, the disc there that joins those two bones together. So the two pubis bones are joined together by this disc of fibrocartilage that allows a little movement between the two pubis bones, but not too much, and at different times we can experience more movement. So during pregnancy is one time where we might see more movement there. Okay, so moving on, what we want to do now is focus on our synovial joints. So remember, we're discussing the joints of the body here in terms of their structural classification. We've talked about the structure of a fibrous joint, how they are tightly knitted together, and a cartilaginous joint, how they are also tightly knitted together but allow a little bit more movement when compared to a fibrous joint. The joints in the body that we are most interested in this module are going to be your synovial joints, the ones that facilitate movement. They're the most most common type of joint in the human body, and they are specifically designed to allow for smooth movement between the adjacent bones. There's 6 types of synovial joint in the body. We're going to have a look at each one of them in a little bit more detail, but first we're going to look at the certain specific characteristics that are unique to a synovial joint and how they operate. So first of all, we've got an example here of a very, very basic joint. So we've got 2 bones meeting together here, and there's a synovial joint between at the point where those 2 bones join together. So one of the things that characterize a synovial joint is the fact that there's an articular capsule. So this is the capsule here that encapsulates, so that surrounds or closes in the synovial joints. So the articular capsule encapsulates the joint, it seals it off from the outside, it makes it a closed unit, if you will, and that is one of the unique characteristics. That articular capsule has an outer fibrous layer of connective tissue, and it's got a layer of an inner layer called the synovial layer, which is another defining characteristic. That inner layer of the articular capsule is known as the synovial membrane. So we're looking at that inner layer of the capsule here, and it lines the articular capsule, and it secretes synovial fluids. So this membrane here secretes fluids, deposits fluid into the joint capsule and fills it up with that synovial fluid. The synovial fluid itself is a thick, slimy fluid that's specifically designed to provide lubrication to the joints. So remember, we want these 2 bones to move, this joint to move freely. So we want the point where these 2 bones to move to be as smooth and as well lubricated as possible. So we've got the joint cavity, which is the space inside the articular capsule where the 2 bones meet, and that is full of synovial fluids that is secreted by the synovial membrane that is part of the articular capsule. The purpose of that synovial fluid is to reduce friction between the bones of the joint, and it also provides nourishment to the joint also. Next, we've got the articular surface. So we've mentioned this previously. At the ends of our long bones in particular, we said that the ends of those long bones are lined or covered in articular cartilage. So that articular cartilage there is a smooth cartilage that is again designed to reduce friction in the joints. So the bone, compared to the articular cartilage, the surface of the bone is very rough, not smooth. So if those two, if bone was to meet bone without this cartilage here, the movement would not be, would be less smooth. It would be less free to move across each other. So this articular cartilage there smooths out the end of the bone, again further facilitating smooth movement in the joint or around the joint where the 2 bones meet. I'll just jump back to my other screen here, and if we look, we'll zoom out, take that connective tissue away, and if we pick the femur, for example, the femur is the long bone of the upper leg, your thigh bone. If we isolate that femur, what we can clearly see then is the long bone shape. And remember, in our earlier lecture we referred to the different portions. The diaphysis is the long shaft of the bone. The epiphysis are the proximal and distal ends of it. And here we see this articular cartilage. So at the end of the bone there, this is where the knee joint is, we see it's lined with this articular cartilage, or at the proximal ends where the hip joint occurs, we see the head of the femur is lined in can I select that? I don't think I can select it in this view. Is also lined in cartilage. So that's the ball of the hip joints will fit into the socket of the hip joints, which allow free movement. That end, either end, the proximal up here and distal ends of the bone are covered in that cartilage. Back to our synovial joint characteristics. Inside the synovial joints, there's a number of little other structures. So we've got articular discs. These are small oval-shaped discs that separate out some of the spaces in the joint. They are there to provide shock absorption and cushioning in the joint. Very, very similar to our articular discs, we have specific ones called the meniscus. The meniscus are larger and are kind of a C shape, and generally when someone is talking about a meniscus, the meniscus, or if you hear someone say I've torn my meniscus, they are referring to the menisci or the meniscuses that are located in the knee joint. And again, these are here to provide shock absorption and cushioning and to aid smooth movement of the joint. So again, just to illustrate this, if we flick back to our anatomy and if we look at the knee joint here, so what we see here, we're just looking at the skeleton at the moment. So we see where the femur, the long bone of the thigh, meets the tibia, the long bone of the lower leg, the shin. And we see where the two surfaces are where they meet, have the cartilage layer there. And if we start to add in our connective tissue, what we've got there is our lateral meniscus of the knee joint. So if we just look at that on its own, is this disc, this disc is kind of a crescent shape or C-shaped disc of cartilage there that sits in the knee joint there. It partly separates out the area, provides some stability, cushioning and shock absorption, and facilitates smooth movement. So you can see there how it sits in. We look at it there and it just kind of provides that little bit of extra cushioning support and smooth movement there of that joint. So if I take that layer back out, if it wasn't there, we would just be looking at the knee joint like that. So that little meniscus is very important. So an articular disc or a meniscus, very, very similar. Meniscus, generally speaking, we're talking about the knee joint. Articular discs are found in other joints around the body. They provide shock absorption and cushioning and they aid smooth movement. Another specific characteristic of a synovial joint is another structure called the bursae. They're small sacs that are lined with a synovial membrane and filled with synovial fluid. They're like little cushions or pillows of synovial fluid, little sacs full of fluids, or like a water balloon maybe, that kind of thing, full of synovial fluid, and they're specifically located where skin, ligaments, muscles or muscle tendons can rub against each other. So what we're looking at, what we're looking at in the image here is the knee joint. So we can see the femur, the tibia, the kneecap here, and we've got this big tendon that joins the quadricep muscles. The patella is located inside the tendon, and that tendon inserts onto below the knee joint onto the tibia. So just here, if you were thinking as you're bending and flexing and extending your knee here, there's going to be a little bit of wear and tear, a little bit of friction where this tendon meets this bone here. So in that area we've got a bursa, a small fluid-filled sac that's there to provide to reduce friction and aid movement. So just provide a little bit of cushioning, reduce friction here, and aid the movement. Bursitis is a common injury that people will occur, and bursitis is when your bursae in your synovial joint has become irritated and swollen and inflamed. So tennis elbow is bursitis of the elbow. So it's a kind of a repetitive overuse injury. The bursae, that little fluid filled sac, has become there's been excessive movement, so there's where these muscles, tendons, ligaments rub against each other, there's been excessive rubbing, and that fluid filled sac in the process of doing its job has become irritated and agitated and has become swollen, inflamed and painful. So that's what bursitis is. Okay, so they're the characteristics that are unique to a synovial joint. So we've got how the joint is structured, and some specific things inside the joint, like the synovial fluid, the meniscus, the bursae, the articular discs, that are all there to aid smooth movement. We're now moving on to the types of synovial joint in the body. So the first one is a ball and socket joint. So this is the type of joint that we see at our shoulder or at our hip, and essentially we've got a ball fits in to a socket, and it allows lots of types of movement like we see in the image here. So if you've got a ball fitting into a socket, you are free to move in many directions. So a ball and socket joint will allow for flexion and extension, hyperextension, adduction and abduction, internal and external rotation. Now, in a future tutorial, we're going to go through all of these terms in more detail, but so if those terms are unfamiliar to you at the moment, don't be worried too much about it. But basically what we are saying is that at a ball and socket joints, if you look, you can see my shoulder in the video there. I can move it this way, I can move it that way, I can move it this way, I can move it that way, I can rotate in the joint there, and I can move around in circles like that. So there's a lot of movement that's available at a ball and socket joint. It is the most freely movable type of joint that we see in the body. Going back over to our skeleton, if we bring him back down here, we said that we see the shoulder joint up here is a ball and socket joint. So if we zoom in there, we see, we'll look at this in more detail, but we've got our upper arm, our humerus, meets our shoulder blade here, and there is a kind of a socket formed here, and there's a ball formed here, meaning we've got a ball and socket joint, a lot of movement going on there. And if likewise, if we look at the hip, we've looked at the femur in isolation. We saw that the top of that femur is a ball shaped. What we also have then is the bones of the pelvis. If I just isolate them, we see that we have a lovely socket formed here. So that's the socket of the hip joint. Specifically, it's called the acetabulum. Is that the name of that socket there? And if we go back out, we've got you can see the socket of the shoulder joint there. So it's part of the socket there. That is called the glenoid fossa there specifically. Now you guys don't need to know that. That's just a little bit of extra nice information to know. So there are two ball and socket joints, the hip and the shoulder joint in the body there, which we've got nicely illustrated on our next slide. We have the shoulder joints, where the humerus meets the shoulder blade, and that's the proper name for that is the glenohumeral joint. So we mentioned that this little part of the shoulder blade is called your glenoid fossa, and your upper arm is called your humerus. So your glenohumeral joint is where the glenoid fossa meets the humerus. That's the fancy name for your shoulder joint. And your hip joint, we know that we've mentioned a few times, this bone, the long bone of your upper leg, is called your femur, and we've said that this part of your hip, the socket, is called the acetabulum. So what we've got there is the acetabulo-femoral joints, where those two bony structures meet together. Synovial joint number 2 is a hinge joint. It's a much more simple type of joint than the ball and socket joint. It only allows for two different types of movements, flexion and extension. So the two main types of hinge joints in our body are our elbow and our knee joints. So our elbow joint in the image there is just called our elbow joint, and here we've got the fancy name tibiofemoral joint, where our tibia meets our femur. We have our knee joint, our tibiofemoral joints, and they allow flexion and extension. So you can see my elbow there. I can flex my elbow, I can extend my elbow. So at that hinge joint, there's two types of movement allowed, flexion and extension. Next, we've got a pivot joint. This is a fairly unique type of joint in the body. There's not too many examples of it. And the pivot joint allows for rotation. So the main type of pivot joint that we have in our body is in our neck. The top two vertebrae of your cervical spine. So remember we said in the spine, when we're looking at the spine, we've got individual vertebrae that make up the spinal column. At the top, the superior portion of the vertebral column is called your cervical spine, your cervical vertebrae, and the most superior bones of that, so cervical spine number 1 or cervical vertebrae number 1 and cervical vertebrae number 2 have specific names. We've got your atlas and your axis, and the two of those together form a pivot joint. So we can see here that the axis, which is cervical spine number 2, has this little bony prominence sitting up, and the atlas has a nice ring there with a little joint. See this little surface here that sits down on top of it. And if we look over to the little image here that's moving, we've got that where the atlas and the axis meets, the atlo-axis joint, and that allows us to pivot or rotate around. So for me, if I wanted to shake my head as if to say no, that rotation of my skull is facilitated by the pivot joint that is between the atlas and the axis. Okay, so a fairly specific type of joint there. Moving on, we've got what's called example number 4 of our synovial joints is a condylar joint. A condylar joint is somewhat similar. It's like a shallow ball and socket joint, if you will, here, and allows 4 types of movement: flexion and extension, abduction and adduction. And an example of that is the bones of your wrist. So where the long bones of your forearm meet the short bones of your wrist, we've got a condylar joint there. So it allows, where's my wrist there? I can flex my wrist, I can extend my wrist, and if we look at it from this side, I can move it to the side, I can adduct and abduct it. Flex, extend, abduct, adduct. They're the movements that are involved at the condylar joint there. So it allows more similar movement to a ball and socket joint, but more limited. Okay, kind of similar in structure. Next, we've got a saddle joint. A saddle joint, again, a fairly specific type of joint. As you can see here, it looks like a saddle on a horse with a rider sitting on top of it. Okay, so that's where the name comes from. A saddle joint allows for these types of movement here: abduction, adduction, flexion, extension, and a little bit of circumduction. And again, what we're looking at there is where the bones of the wrist meet the bones of the hands. We've got a saddle joint, and that's where we see those types of movement there. So specifically where those joint bones meet, we can allow a little bit of extra movement there. So our wrist is very mobile because we've got 2 different types of joints located in close proximity to each other. We've got the condylar joint, which is located where the bones of the forearm meet the wrist, and we've got the saddle joint where the bones of the wrist meet the bones of the hands. And combined there together, those joints allow for a pretty decent range of motion or types of movement at that joint. That's number 5. Number 6 is called a plane or a gliding joint, and that's where two flat surfaces meet each other, like we see here, and they allow for gliding or sliding movement. And an example of that is the acromioclavicular joint. So that is in your shoulder, where your clavicle, your collarbone, meets a specific structure in your shoulder blade called your acromion. So your acromioclavicular joint, where the clavicle, where your collarbone meets your scapula, where your collarbone meets your shoulder blade. And that, if you put your finger onto your collarbone and walk it out laterally until you're you'll feel a kind of a bony lump at the lateral end of your clavicle there. and that is where your acromion process is. That's the bony lump on the end of your scapula that we feel there. And if you pull your shoulder up and down, what you're feeling there is movement at that plane or gliding joint. If you move your shoulder forward and back, there's very limited movement, but there is movement available at this joint here to facilitate the shoulder going up and down, and to facilitate it coming forwards and back as well. Okay, so that's the 6 different types of synovial joints: our planar gliding joints, the saddle joints, a condylar joints, a pivot joints, a hinge joints, and our ball and socket joints. Okay, we have focused on the types of joints that are in the body based on their structure. So the 3 types of joints based on structure are fibrous, cartilaginous, and synovial. We then took a deeper dive into the synovial joints. We looked at the characteristics that are unique to a synovial joint, and we looked at the 6 different types of synovial joints that are in the body. We shall leave it there today. Thank you very much for your attention. I will catch you in the next tutorial.